Sponsored by the Carpal RX. If you have hand pain, wrist pain, or forearm pain, you might be confused as to whether you have carpal tunnel syndrome or tendonitis. These two conditions share similar symptoms, but do you know the difference between the two? Carpal tunnel syndrome is a problem that occurs deep inside the wrist, inside an area known as the carpal tunnel. The flexor tendons, here shown in white, are surrounded by a fluid-filled sheath, shown in blue. Under certain conditions, this fluid-filled sheath tends to swell, and that swelling pushes on the median nerve, here shown in yellow. That compression on the nerve causes it to become irritated, and that's what produces the pain and other symptoms of carpal tunnel syndrome. The cause of wrist tendonitis is slightly different. Here, the flexor tendons or their sheaths running up and down the forearm may become irritated, and that irritation is not confined to the carpal tunnel. The result of such tendon irritation is usually pain and either soreness or tenderness. So whether you have carpal tunnel syndrome or wrist tendonitis, what can you do for these conditions? The answer is deep tissue massage therapy, which is nearly 100% effective in treating these conditions. But it's only effective if you use it daily for 2 to 4 weeks. Visiting a therapist only once a week for massage therapy is worthless. So how do you get this effective deep tissue massage daily without visiting a therapist daily? The answer is the Carpal RX. If you have carpal tunnel syndrome, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.